Hello, everybody. I'm Dr. Michelle Rathel with Revolutions Naturopathic, and we are here with Dr. Jamie Brinkley, and we're going to be talking to you about hormone testing. There are several different kinds, and Dr. Brinkley is an expert and has been practicing this for a really long time, and it's one of her biggest passions, is helping men and women figure out how to balance their hormones and keep themselves young and healthy for as long as possible. Now, we just want to qualify this and say this isn't medical advice, so this is some generalized information to get you started with your education on the subject. If you need personal medical advice, we are available via telehealth while the whole COVID-19 thing is happening, and we can definitely take care of you long distance. We will be posting, we'll have a question and answer session at the end of Dr. Brinkley's presentation, so go ahead and post your questions in the chat, and I'll make sure to write those down and get to that at the very end of the presentation. And with that, I am going to leave you in Dr. Brinkley's brilliant, capable hands.
Hi there, I'm Dr. Brinkley. It was a wonderful introduction, Dr. Rathel. So let me go ahead and share my screen with you. But before I do, I just wanted to give you a little bit about my background. For those of you who aren't familiar, naturopathic doctors are experts in natural medicine. We are primary care providers, and me in particular, I really do quite a bit more hormone balancing in my practice for men and women, but mostly for women in terms of anyone who's going through menopause, anyone who has irregular menses, endometriosis, PCOS, or struggling with fertility. That's mainly my focus. And you know, one of the biggest questions and controversies in general with hormone balancing is what method should I use? What method is best? What is available? Because there are a lot of different options, and that's what we're here to talk about today. So, without further ado, let's get started. All right, so when we're talking about hormone balancing, folks often forget that there's more hormones than just estrogen, progesterone, and testosterone. Stress can produce its own hormones, notably cortisol. And when you are experiencing stress, usually you will have, at least initially, an increase in cortisol. That also can cause an increase in blood sugar, or to get you enough fuel for the whole fight or flight response. Basically, this is what happens when we get stressed out, and if it does happen over and over again, the receptors can become less sensitive to insulin and lead to insulin insensitivity and blood sugar dysfunction, and can progress to prediabetes. This can also be a driver for storing more body fat. And then if we are also having a high carb diet, those carbs can be more quickly stored as fat when you are more in this state. You can also, over time, have more issues with cortisol imbalance, such as bone loss. Your muscles can start breaking down. You can start to have trouble sleeping. And I think a lot of folks have experienced that. It can lead to a worsening of high blood pressure. Certainly, cortisol can be both a cause and an effect of depression and anxiety. Anxiety can cause increased cortisol. Cortisol can increase your anxiety, and you can get into a vicious cycle there. Both high and low cortisol states can cause fatigue, and both high and low cortisol states can cause a craving for sweets. This can also affect your libido. I'm sure many of you have experienced that, you know, when you are stressed out, sex is not the first thing on your mind. And the fun thing is that, as you've probably heard me say, a lot of the symptoms can be similar, whether it is high or low cortisol, as ideally the body strives for balance, and we want to stay within a range. The other one that we talk about quite a bit is estrogen. As women age, we can start to have an estrogen deficiency, and that can cause things like hot flashes and night sweats. Those are the things that most women know about and hear about, which can cause sleep disturbances, the dry skin. Not as many women are aware that low estrogen can lead to more foggy thinking. You can have more heart palpitations. Certainly you can have more vaginal dryness, which can lead to painful intercourse, low libido, headaches, memory lapses, yeast infections, depression, and then of course over time it can lead to bone loss, osteoporosis, that type of thing. But on the flip side, if you have too much estrogen, you can have more water retention, so that fun bloating that can happen around that time of the month, or really anytime we have estrogen excess. Breast swelling and tenderness, craving for sweets, fibrocystic breasts, uterine fibroids, nervousness, anxiety, heavy menses, fatigue, weight gain, mood swings. And then estrogen excess sometimes will also mimic symptoms of low thyroid. And so that can also be not such a fun imbalance. And this can also start to happen around perimenopause, or the period of time, like 5 to 10 years before the onset of acute menopause. Some women will experience estrogen excess during that time. And then of course, certainly just even women who are not in perimenopause, but women who we say are premenopausal or just having a normal cycle can experience estrogen excess as well. And then of course, if you take too much estrogen, you can get into this situation too. Progesterone is the other hormone that most women will be familiar with. And low progesterone can also lead to, hopefully these symptoms are starting to look familiar to you: swollen breasts, headaches, anxiety, irregular menses, cramping, infertility, acne, weight gain. Very similar to some of the symptoms of estrogen imbalance as well: low libido, mood swings, depression, PMS, all of those things, joint pain. On the flip side, too much progesterone is also a bad thing. This most commonly I see when women have been taking too much progesterone, prescribed by their provider. Very rarely do I see this just normally without any kind of intervention, but you can, from too much progesterone, have somnolence or just being really, really tired and fatigued. You can have some depression. You certainly can have some yeast infections, vaginal yeast infections, bloating, breast swelling, and it does look like estrogen deficiency, so it can be sometimes hard to differentiate without testing. Testosterone imbalance also isn't super fun. We can have libido issues, memory issues, palpitations. Bone health can also be affected by low testosterone, especially in men. Vaginal dryness for sure, depression, aches and pains, and that's perfectly illustrated here by this photo, or by this fun cartoon I've got here. Okay, so now since we've established that testing can be pretty important for determining hormone imbalance, well, what is the best way to test? So it depends on the hormone, and it depends on the patient is really the answer here. For cortisol, you can test it actually any of these ways. You can do blood testing, saliva, or urine. I prefer to do a saliva test, mostly because I like to get a 4-point result, because with cortisol, sometimes it is very time dependent in terms of when a patient can be having symptoms. So if anxiety, for example, is peaking in the morning, and we don't necessarily do that test at that exact time, we might not catch that. Or if, your own anxiety is just happening before bed, or you're waking up frequently in the night and we just do an AM blood cortisol, we might not catch that. But all of those methods are valid ways to test cortisol. You just have to realize what you're looking at when you are, performing those tests. DHEA, same thing, blood, urine, or saliva. Estrogen, same thing. We can do blood, urine, or saliva. But for estrogen, the timing of this hormone is crucial for cycling females. Because throughout the month, estrogen will have dramatically different levels. So when a woman is menstruating, that estrogen can be peaking around day 3. If we wait, and if we're closer to ovulation, that can be another peak. But if we're kind of in between there, it can be a lower level. And so we want to always try to compare it to the appropriate time in the menstrual cycle. Sometimes that's tricky if cycles are irregular and if there's limited availability in someone's schedule to come in for a blood draw. You know, like if we're doing a day 3 or a day 21, as many of you know, you have jobs and sometimes it's not convenient to come in at a certain time. Excuse me, I've got a little bit of allergies going on. So that can be a better spot to have a urine test performed, just because that can be done at home. Saliva is another one that can be done at home, and we would still time it for that cycling female, but that might be more convenient. Now, if they are postmenopausal, the question is, are they taking hormone replacement therapy yet or not? Now, if they are taking hormone replacement therapy, I don't always like to do a saliva panel for that woman. The reason is, especially if they're doing a cream hormone replacement therapy, a topical patch, that saliva test can come back falsely elevated. And I have seen that quite a bit, just because that saliva test is very sensitive, and especially sensitive to things that are applied topically. And so if a woman is postmenopausal and taking hormone replacement therapy, I would prefer to do a urine or a blood test with her. For progesterone is the real difficult one to measure accurately. Progesterone, like estrogen, will also rise and fall with a menstrual cycle, but it also cycles every 90 minutes as well. And so for that reason, if we really have to be super accurate with a progesterone level, I will prefer to do a urine measurement for progesterone. Now, that's not to say I don't do a saliva or a blood test for progesterone, but it just depends on what the goal is, and if we're, if for some reason we're not getting good results with what we're doing, and if we're not doing urine, I might switch someone over to a urine hormone test to really get a more accurate measurement of progesterone, because a urine test for hormones is over a 24-hour period, and so it measures sort of the total 24-hour volume rather than that static measurement that you get with blood, or sometimes with saliva, as that saliva test usually excuse me, takes about 15 minutes to collect that saliva sample. For testosterone is not as fussy. Testosterone is all right, blood, urine, or saliva. But same thing in terms of if someone is supplementing with a cream, I don't like to do the saliva. For men, especially that testosterone, it is crucial to have that in the morning, as that is usually for men when the highest level of testosterone occurs. Throughout the day. It peaks during the day and falls off the rest of the day. It is also critical to know, of course, are you already taking testosterone, and how are you taking testosterone? Are you dosing once a week by injection, or are you taking a daily cream? It is really crucial to make sure you know at what point in the dosing cycle you are testing. For example, I have had a patient where they did apply their cream minutes before a blood draw, right where the needle went in, and their result came back really crazy high. It was in the thousands, and we were all a bit confused until we realized that they had applied their cream literally minutes before the needle punctured that part of the skin, and so the blood sample looked really high. But you can have you can have a result similar to that without it being that close. So it's just important to have an experienced provider that's familiar with the particulars of testosterone testing and really any hormone. For thyroid, really the standard thyroid hormone test is in the blood, and that has been established over the past several decades and works well. All right, so now that we've talked a little bit about the testing in relation to the individual hormones, in general, there's advantages and disadvantages to each method of testing as well. So for saliva hormone testing, we kind of talked about already that topical hormone creams can make the results artificially inflated. But saliva can be awesome if people really don't want to get poked and don't want to do a blood draw or are very averse to that. The test itself is very highly sensitive, which is a great thing if we're trying to detect very low levels. We can do multiple samples with saliva without having people come in for multiple blood draws. So we can do a day 3 and a day 21. We can do, you know, we can do several different points in the cycle. We can have them test every 2 or 3 days to see a complete menstrual cycle, which is great. Sometimes saliva testing is cheaper than doing a blood draw in some cases, and patients, of course, can do it from the comfort of their own home. Now, the disadvantages are that sometimes that the test is too sensitive, and you can get a high rate of contamination. For example, if someone had touched their creams and then picked up the tube to do the saliva test, sometimes that will come back as contamination on that sample. There is a little bit more room for user error than with a blood draw, as you know, it's kind of all up to the patient when they're at home to kind of figure that kit out. And so sometimes it's not a good match depending on who's doing the test. The other thing is that it can take 2 or 3 weeks to get the results from a saliva test, and sometimes we don't want to wait that long. And then sometimes if they're already taking creams or patches, it's, as we talked about, we don't necessarily want to run saliva, but otherwise I use it quite a bit in my practice. Blood hormone testing is a lot more common. Sometimes insurance companies will cover blood hormone testing, so that can be really important for patients. It can be convenient if you're already having other labs drawn, like if we need to run a thyroid hormone, or we're doing cholesterol, or looking at blood sugar, that kind of thing. There's certainly, excuse me, my goodness, got a frog in my throat today. There's certainly less room for patient error. It's great if all you need is one data point, and then results are really fast. They're less than a week. It's not great if you don't want a blood draw, if you're afraid of having your blood drawn. Sometimes it's not as convenient to have to schedule that appointment and go somewhere, especially right now with the COVID-19 pandemic. And then if you need multiple samples, it can be okay, but sometimes it, again, just compounds that convenience issue. Urine hormone testing is, as we said, the most accurate way to measure progesterone in particular. We can also see a lot of other really cool metabolites of the hormone. So what that is just the way that your body is breaking down the different hormones that you either are producing or that we're giving you. Definitely no needle required there. Don't have to come into the office. We can get multiple data points there as well. And then the disadvantages, though, is that, again, because it's up to the patient to do it from the comfort of their own home, there can be more room for error than blood testing. They can be a little bit more expensive than the other 2 methods, and it can take a bit longer to get results for that as well. Excuse me. So basically, it's not necessarily a cut and dry thing. What is the best way to test for hormones? But it is important to do some testing and to identify what's out of balance. The other thing, of course, is we don't just do hormone testing. We also will take a history, do as much of an exam as we can. And then we'll come up together with what we need to do in terms of the other things. So dietary changes, lifestyle modification. So, how is your sleep? Are you having any other symptoms going on that may not be necessarily related to your hormones? What are you taking in terms of supplements? What are you taking in terms of other medications? you know, and then there's just quite a bit that we can do to get those hormones balanced, you know, with herbs, with diet, with nutrients, amino acids, those type of things. And if you're interested in learning some more or becoming a patient, I am taking new patients. And I'm going to go ahead and give it back to Dr. Rathel.
All right. So that was really informative. Thank you so much, Dr. Brinkley. I'm always amazed at your wealth of knowledge. We did have a couple of questions. One of the questions that came up was, is there a screening age that you should be doing these tests for, even if you don't have symptoms?
So if there's, I don't necessarily say everyone needs to get their hormones tested by, you know, 35 or by 40. Usually it is based on symptoms, but sometimes the symptoms are not super obvious. So sometimes there's things that are going on that you might not suspect are related to hormones. But no, that's a really good question. I don't usually say like everyone by 50 needs their hormones tested. It really try to match it to what the patient's needs are.
Okay. And then how often should you get tested?
Well, as often as we need to. So sometimes it's just one time and we start a treatment and people are feeling great. And then maybe after that, we'll check in once a year at the most in that situation. Sometimes we're doing more frequent testing if we're having to do a lot of treatment changes. And sometimes women don't need hormone testing, but I'd say that's more of a rare case in my practice.
Okay. And how often are you able to provide this kind of care just with telehealth? Is it something where you have to come into the office, or are you able to work with people that are kind of further away?
Yeah, for something like this, we are by and large able to do most of it exclusively through telehealth. If you live in the state of California, our license extends to everyone in the state of California. The only caveats to that are if there is a need for some type of physical exam, if it's good if they do have a local provider to do that portion of it. And certainly if that's the case, then that's something we can talk about on a case-by-case basis.
Okay. Well,
but mostly, yes, everyone can do it on telemedicine by and large.
Wonderful. Well, that's all the questions that we had. So thank you so much for your time. Can you pop that information slide up on the screen, and
Sure.
We'll just let people have the chance to take down that information. If you're interested in knowing more for yourself or for a family member, Dr. Brinkley does free 15-minute coordination meetings. So you can speak to her directly about your specific needs and concerns, and she can give you an idea of what all would be involved in your needs for testing and your needs for treatment and ongoing care. So we do have brick and mortar locations in Northern California. We have one in Folsom, California, and one in Roseville, California, which is in the greater Sacramento metropolitan area right here in the foothills.